Dead. Yeah, someone said dead. So that's right. Basically, that's the only, I mean, even when you're sleeping, you know, you can do some twitching and there's some dreams can stress you. It's interesting. I was telling Sally just today when we were taking a walk, I said, you know, I can't remember if it was last night or night before, but I remember I just recently had a stressful dream. I did something completely crazy, social goof up, and I can't remember what it was. I'm so glad, because if I remembered, I'd probably be even more embarrassed, but something I dreamed I did, which sounds very realistic. But anyway, so stress, we have two kinds of stress, all right? So there's what we call eustress, and then there's distress, you might call it. So eustress means true, right? True. So there's a good kind of stress that we need if we want to have health and be productive. In fact, there's a very interesting curve. They don't show this on the slides, the video, so I want to mention it to you. They've actually done a research that has looked at, on the y-axis is performance. So the higher up you are, the better your performance, and over the x-axis is the amount of stress. And what happens is the curve is a U-shape. So it goes up as you get more stress, good stress, your performance goes up, and then it reaches a sort of a plateau and starts to drop off suddenly, because when you get overstressed, your productivity actually drops. And so does your health, as they're going to bring out. Chronic distress, chronic stress that is not helpful over time can produce a number of diseases. One other thing I'm going to mention they do talk about in the video is, do you know that there's many times more of your immune system that's tuned into your GI tract than anywhere else in your body? We have, you know, we might think, well, how about I need immune cells in my skin. What if I have a cut or a break or an abrasion? Yes, but you got a lot more surface area in your GI tract, and a lot more immune cells are monitoring what happens there. And why that's so interesting is we have more bacteria living in us and on us than the number of cells in our body. So it turns out that there's a big connection between the microbiome, our brain, our stress, and our health. So let's see what they have to say, and then we will talk a little bit about it afterwards.
Throughout the trip journey, we have
In this session, Dr. Darren Morton shows us why stress can cause all manner of health issues and, importantly, what we can do about it.
Imagine the following scenario. You're driving in your car without a care in the world when suddenly you hear, woo, woo, and you look into your rearview mirror and you see these blue flashing party lights on the top of the car behind you. And then you notice that the driver of the vehicle is wearing a party hat, indicating that you need to pull over because he has a present for you. Now, you don't even bother to look down at your speedometer because you know the needle should be about here, whilst it's actually about here. You know, perhaps you don't even need to imagine this scenario, as it's only all too familiar to you. But imagination required or not, I'm sure that you can identify with the changes that occur almost instantly in your body. That's right, your heart begins to race. You can feel it pounding in your chest. Your palms go all sweaty. Your muscles tense up. You start to breathe erratically, and those butterflies in your tummy go berserk. Don't you hate those feelings? Well, these are all symptoms of what is referred to as the stress response. And while most people don't find them pleasant at the time, believe it or not, the stress response is actually designed to help us. You see, it helps us deal with emergency situations. Essentially, what it does is gear our body up for fight or for flight, neither of which, I might add, are recommended when being pulled over by the police. But they are very appropriate if being pursued by, say, something that wants to eat you. For example, a racing heart, increased breathing rate, and energised muscles all help give us a jump start when attempting to outrun an angry bear. But while the stress response can serve us well in the moment, it's not helpful when constantly activated. Back in the 1950s, pioneer stress researcher Dr. Hans Selye first observed that a chronically activated stress response can cause all sorts of problems. And since that time, extensive research has demonstrated that ongoing stress can result in many poor health outcomes. And this includes diseases not traditionally thought of as stress-related. For example, there's emerging evidence that stress plays a part in type 2 diabetes. And this is probably not that surprising, given that one of the functions of the stress response is to alter the body's blood sugar level. Anyway, the point is that ongoing activation of the stress response, even if it's just ticking away in the background at a level we're not consciously aware of, can cause serious health consequences. And unfortunately, many people today, especially those living in developed countries, have a chronically activated stress response. In the United States, for example, 4 out of 10 employees say they typically feel stressed out during the day at work. And of course, work is only just one source of stress. Family, finances, and our health can be other common concerns. So why is it that ongoing stress can have such a profound effect on our health? Well, there are 2 reasons. And the first is that when we are stressed, we tend to behave differently. We tend to make poorer lifestyle choices. For example, what does stress do to your resolve to eat healthily? You say to yourself, today I'm not going to eat any chocolate. And then on your way to work, your car gets a flat tyre, and of course it's raining, which means you get to work late for that important meeting, looking like you've just lost a fight with a fire hose. And your day goes downhill from there. Suffice to say, you find yourself craving a chocolate bar as big as your mattress. And every time you walk past a vending machine, you hear little voices calling to you from inside. I'm in here. You know you want me. I can make you feel better. In fact, have you ever noticed that stressed spelt backwards is desserts? There might be something in that, hey? Well, what we know is that individuals who are stressed are more likely to behave in ways that put them at greater risk of ill health. They get poorer sleep, they have a greater propensity for alcohol use and drug abuse, they eat less nutritious foods, and they exercise less. Can you identify with this? What changes do you notice in your behaviour when you're stressed? Perhaps you find it difficult to fall asleep, or you wake up in the middle of the night and can't get back to sleep. Or perhaps you sit in your armchair and resist movement at all costs. Or perhaps you get snappy at others. Or you might have food cravings that you succumb to. Or you might let the house get ridiculously messy, such that when someone knocks at the door, you hide, so you don't have to open it and reveal the carnage inside. You know, all these can be signs that our stress levels are rising. And these signs are worth taking notice of, as managing stress starts with recognising we're suffering from it. So what we learnt is that stress can compromise our health by making us behave badly. But what we're discovering is that stress also has a direct effect on our health, because what goes on in our brain affects what manifests in our body. You see, the stress response excites a cascade of interactions between the brain and the body, and it's referred to as the HPA axis. Or if you like big words, the hypothalamic pituitary adrenal axis. And one of the outcomes of activating the HPA axis is the release of adrenaline from our adrenal glands, which sit just on top of our kidneys. Adrenaline, as you know, has a powerful effect on our cardiovascular system. It's adrenaline that causes our heart to feel like it's going to leap out of our chest when we get a fright. Adrenaline also causes our blood vessels to constrict, which drives up our blood pressure. Now, while these responses are helpful in emergency situations for getting oxygen and nutrients to our muscles quickly, they can take their toll. A study published in the New England Journal of Medicine reported that being caught up in heavy traffic, which is stressful for anyone, increases the risk of a heart attack by almost 3 times in the following hour. But while activation of the stress response in the short term can present problems, the greater danger lies when it is activated in the long term, even if it's only activated at a low level. In the InterHeart study, for example, which identified the risk factors that contributed to the heart attacks of over 14,000 individuals from 52 countries, the researchers found that an individual's psychological state was a more important determinant of them suffering a cardiac event than their typical physical activity level, or how many serves of fruit and veggies they consume daily. You see, our psychological state, such as our stress levels, has a powerful influence on our heart health. And there are probably many mechanisms responsible for this. Stress, for example, is known to alter the thickness of our blood, as well as its clotting properties. And so what we can conclude is that ongoing stress adversely affects our cardiovascular system. But let me tell you, it's not just our cardiovascular system that's affected. Our gastrointestinal system is also powerfully influenced. And as you know, when your gut is unhappy, so are you, and possibly those living with you. In fact, we are only just becoming aware of how truly important our gut is. Did you know that the lining of your intestine has a surface area in excess of 100 times that of our skin because of the way it's all folded and convoluted? And your gut is home to, get this, 100 trillion bacteria. That's about 10 times more than the number of cells in your body. In other words, you are 10 times more bacteria than you are human. Doesn't that do wonders for your self-esteem? Well, what we also know is that about 70% of our immune system is distributed around our gut. And that being the case, it should come as no surprise to learn that stress can also powerfully affect our immune system. Indeed, it's now well established that cortisol, which is the main stress hormone produced during the stress response, inhibits the immune system. You think about it from the body's perspective. When you are out running that bear, hopefully, your body isn't interested in anything other than supplying the nutrients that the muscles that are doing the running require. Digesting stuff, worry about it later, it says. Healing, not now, just run. Now, this lack of attention to healing does not present a concern if the stress response only lasts for a few minutes. But as I indicated earlier, when it remains activated, even just at low levels, for days, weeks, months, and years, it becomes a big problem. It's well documented, for instance, that your stress levels can influence the likelihood of you getting sick. Studies have shown that when volunteers are inoculated with a cold virus, and I have no idea who puts their hands up for these experiments, probably needy college students. But anyway, the researchers find that the best predictor of whether the individual will develop the cold symptoms or not is the number and the severity of the stresses they have faced over the previous month. And if you're unwell, your stress levels and psychological state will influence how long it takes to get better. Higher levels of distress and fear prior to surgery is associated with poorer outcomes in terms of longer hospital stays, more post-operative complications, and higher rates of rehospitalisation. But my favourite study that shows just how powerfully stress can affect our immune system was conducted by researchers from Ohio State University. And the researchers somehow, once again, I don't know who volunteers for these studies, but they somehow convinced couples to take part in a wound healing study. The couples were required to front up to a laboratory on 2 separate occasions, separated by a couple of weeks. And the first thing the researchers did when the couples fronted up was pull out their suction blister machine, which was used to create a blister wound on the forearm of the man and the woman. Following the wounding, the couple then sat down with a counsellor to have a nice little chat. Now, on the first visit, the counsellor essentially tried to create warm fuzzies. They asked questions that prompted discussion about feel-good topics like, how did you first meet? And tell me about your first date. And what was your wedding day? Tell me about some of the highlights. Well, by the end of the session, the entire room was aglow and the couple would be holding hands, rocking backwards and forwards while singing Kumbaya. Well, the couple were then sent on their way home, and in the days that followed, the rate of healing of the blister on their forearm was monitored. Well, a couple of weeks later, after the wound had completely healed, the couple came back for another session, but this time, after receiving yet another blistering to their forearm, the little chat had a very different tone. Essentially, the counsellor picked a fight by asking about contentious issues, like directed to the wife, do you feel that your husband communicates effectively with you? And she would go, argh. Then he would turn to the man, he would say, how do you feel about your wife's spending habits? And he would go, argh. Once the counsellor had found a raw nerve, he would stoke the fire and then watch it burn. And after half an hour, he would ring the bell and then send them on their way home. You see, what the researchers were interested in was how much longer it took for the blisters on their forearm to heal compared to the first session. And what do you think the difference was? What difference do you think stress arising from a half-hour argument with your spouse, and obviously the aftermath that ensues, makes to the rate of healing? 30%. Did you hear that? It took 30% longer to heal. Indeed, how you feel affects how you heal. So clearly, stress can have a tremendous bearing upon our health and well-being. And Dr. Robert Sapolsky, author of Why Zebras Don't Get Ulcers, sums it up by saying this. He says, stress can wreak havoc with your metabolism, raise your blood pressure, burst your white blood cells, make you flatulent, ruin your sex life, and if that's not enough, possibly damage your brain. Indeed, friends, we need to manage our stress levels very carefully. So now we've seen that stress can damage your health. I know that you are absolutely desperate to find some solutions. What can you do to manage your stress? Well, to start, I want you to imagine that you are like a boat. And just like boats are meant to float, you too want to float through life and be able to ride above the crest of the storms that come your way. But now imagine that some lead weights are placed into your boat. Obviously, the more lead weights you take on board, the more you sink and the slower you go. You transition from being a speedboat to a barge. Life becomes arduous and tough going in those sorts of circumstances. Now imagine that even more lead weights are placed in your boat, such that the water level is almost lapping at the gunwales. It doesn't take much more and your boat is sunk. Well, stress is like those lead weights. Now, I should point out that we're not all boats of the same size. Some of us are large vessels and can carry a lot of stress and still stay afloat. I know of people who have an incredible capacity to have many things on the go at the same time. They seem to thrive when racing around with their hair on fire. Whereas others among us have smaller boats, and it doesn't take as much to swamp us. Now, this is not to say that one's good and the other's bad, but it is important that we're aware of the capacity of our boat, because it's our boat we need to float. And at any given time, we also need to be aware of how low we're sitting in the water. When we are heavy laden and precariously close to sinking, a relatively small addition can be all it takes to sink us. Have you ever been just coping and then the smallest thing tipped you over the edge? You see, keeping our boat afloat involves carefully managing how much stress we have on board. And that involves balancing how much stress we take on and how much stress we offload. So let's look at how we can achieve this balance, starting with what we can do to take less stress on. Well, there are a couple of obvious things we can do to help achieve this. Firstly, limiting our exposure to situations we find stressful, as much as we're able, that is, can be extremely helpful. And of course, we all get stressed to varying extents about different things. For example, you randomly select a group of individuals and stand them in front of an audience to tell a story, and some will activate a stress response bordering on panic, while others will be completely relaxed, and you'll have a hard time prizing the microphone out of their hand. So being strategic about limiting our exposure to situations we find stressful can be one way to keep our boat afloat. Learning to say no can be really helpful in this regard. Do you ever feel pressured to be all things to all people? Does it stress you out? You know, sometimes we need to lower our expectations of ourselves, about what we can achieve, acquire, or become. And sometimes we need to lower our expectations of others. And then sometimes we need to help others lower their expectations of us. You know, one of the most liberating discoveries I ever made was recognising what I'm not good at. And the reason it was so liberating is because there are so many things. You see, we all have different strengths and weaknesses, and constantly operating within our weaknesses can be really stressful. Just as Plato suggested, it's a good idea to know thyself and stick with your strengths as much as you're able. Life will not only be less stressful, you will also make a better contribution. Now, I'm not suggesting that this is a cop-out, by the way. Washing the dishes is not one of my strengths. But what I am saying is it can be sometimes very helpful to steer away from tasks that you're not so good at. You don't have to take something on just because someone else has asked you. A final strategy that can help us take less stress on board involves clarifying our worries. And Dr. Andrew Weil from Arizona Medical School asserted that managing stress has a lot to do with how we worry, and managing worry has a lot to do with where we focus our attention. And he adds, humans are the only creatures that create stress with their own minds. Humans certainly have an incredible potential to create psychological stress through worry. In fact, worry is arguably the greatest cause of human suffering. And in this regard, we can learn a lot from our striped friend, the zebra. You know, to the best of our knowledge, zebras don't worry. Zebras don't wake up in the morning and instantly think, I wonder if the lions are hungry today. You know, it has been a few days since old Black Ears got taken. I bet they are. You know, I can see it now. We're going to be down by that water hole, and suddenly that pride is going to come charging down on us, and I know who they're going to pick on. Me! Look at my stripes. I stand out from the crowd, and I'm sure my legs are shorter than everyone else's. Oh no, I don't stand a chance here. I'm a dead zebra walking. You know, zebras don't catastrophize in that way. Only humans do, and it fills our boat with stress. You know, one useful strategy for gaining better clarity on your worries is to determine whether the things you're worrying about are things that you have control over or not. Now, while it's admittedly easier said than done, worrying about things outside of our control is somewhat futile and therefore not very constructive. You know, we worry about what if, and in so doing we use today's energy on tomorrow's problem, which, by the way, may never eventuate. Of course, worries that we do have control over deserve appropriate action, and courageously dealing with them can be very effective for bringing our stress levels down in the long term, even if it does cause a little more stress in the short term. Another potentially powerful way to gain clarity on your worries and bring down the stress response is to talk with someone or something about your concerns. Talking with a friend, colleague, professional counsellor, or even praying can be all effective ways to vent and process our worries. Indeed, a burden shared is a burden halved. And even if the listener doesn't offer wise advice, of course it's nice if they do, the act of talking it through can be what our brains need to gain clarity on the situation. Talking it through can alert us to the fact that probably 90% or more of what we worry about never actually happens. And Mark Twain once commented, I have known a great many troubles, but most of them never happened. And so things we can do to prevent our boat being too overloaded include clarifying our worries, lowering our expectations, and limiting our exposure to situations we find stressful. But you and I both know that despite our best efforts, sometimes life throws many stresses at us simultaneously, and we can find ourselves amidst circumstances out of our control. Like I was once chatting with a lady and I felt compelled to ask her, I said, are you okay? You seem a little stressed. And she replied, she said, my car blew up this morning. And the mechanic said it's going to be a very costly fix. I went, that's no good. And then she continued. She said, yeah, and finances are a bit tight at the moment. She said, my husband, hasn't been able to work and all. And then she paused and finished with, the chemotherapy's really knocked him around. Indeed, sometimes life deals us hard blows. And at such times, having effective coping strategies to help lighten our load becomes vitally important. And of course, some of the strategies I've already mentioned can help with this, such as talking things through with someone. And clearly, this is what that lady needed. Indeed, social support is really, really important. But let me share with you two especially effective techniques for dialing down the stress response. The first of these is, I love to say it, exercise. You see, as described earlier, the stress response gears us up for fight or flight. And in case you haven't noticed, both of these are physical pursuits. To return to our friend the zebra, when it looks up and sees a lion barreling down on it, it experiences an immediate stress response. And that stress response gears the zebra up to either fight or flee, and presumably all living zebras opt for the latter. Well, of course, there are two potential outcomes of the chase. Either the zebra outruns the lion and gets away. Well, actually, probably only needs to outrun the slowest zebra in the herd, but it either gets away or it gets caught. And in either instance, the zebra's stress response quickly subsides. Not long after the chase is called off, you'll find that zebra going about its usual business, foraging for edible items. And the reason the zebra can so quickly return to its relaxed state is because the all-out sprint it did getting away from the lion or outrunning that last zebra. In a nutshell, the stress response gears us up to do something physical. And by acting on it, exercise helps bring down the stress response. Hence, exercise is one of the most effective ways to de-stress. And the fuller our boat, the more important it becomes. I have a friend who has a very high-profile job, and he often tells me, he says, the more I have going on at work, the longer I walk. This is wise advice. The second positive strategy for decreasing our stress levels is to take time out to relax. Now, we all relax in different ways. Listening to music, playing an instrument, playing sport, reading uplifting literature, and the list goes on, obviously. But there is one technique that we can all benefit from, and it's called the relaxation response. Now, the relaxation response is a very simple scientific strategy that works on the premise that by reversing the symptoms of stress in our body, we can reverse the feelings of stress. Now, you might recall that some of the symptoms of the stress response, such as alterations in our immune system or our gut function, we have little conscious control over. And hence we have little hope of directly changing them by simply thinking about them. But there are some symptoms of the stress response that we do have conscious control over. For example, the stress response causes us to breathe shallow and rapidly. But we can intentionally reverse this symptom and breathe more slowly and deeply. Also, the stress response causes our muscles to tense. But through conscious endeavour, we can relax our muscles. And finally, the stress response causes our brains to fire erratically, trying to take in as much stimuli. But we can choose to still our thoughts by focusing our attention on one good thing. So the relaxation response centres on consciously changing our breathing, our muscle tension, and our thinking. And when we practice it, it can be extremely powerful for dialing down our stress response and creating a state of calm. Personally, I find exercise and the relaxation response incredibly helpful for managing my stress levels and keeping my boat afloat. What we've seen in this session is that stress can be incredibly damaging to our health. And as such, it's vitally important that we are alert to our stress levels and take active steps to managing them. And the strategies discussed in this session can be extremely helpful for helping us to achieve that. Be sure to live your best life. Live more.
Well, amazing. Always benefit from that, even if it's just a reminder. While he was talking about the stress, the relaxation response, I was sitting there taking deep breaths, slow in and out. It just triggers a relaxation response. It truly works, and I've taught that to some of my patients and folks that ask for help with their stress. I wanted to just share two little stories that I have borne the test of time. People have really told me these have helped them. So you probably have heard, some of you have heard of this. There's a gentleman who was quite a worrier, meaning that he stressed about things that he thought was very likely going to happen, and so told this little parable to him and says, well, listen, so there's a fellow that was worried about 10 problems coming down the road, and he thought, I'm going to get out there and I'm just going to take care of them. I'm not going to sit around here and do nothing. And so he gets up and he goes and he fights these 10 problems, and he's all worn out. Whereas another person sitting there sees these 10 problems coming down the road and says, I bet they'll just pass me up. So sure enough, all but one passes him by, one comes up in the yard, and so he has to fight that one problem. So the little illustration is that if you anticipate problems that haven't actually occurred yet, like Mark Twain's little saying, you know, I've had many troubles and some of them actually happen. We have to stop trying to fight something that hasn't really we haven't encountered. It's just in our mind. I thought Dr. Morton does an interesting job of personifying zebras, as he calls them. And I agree with him, probably zebras don't catastrophize and worry about the things ahead of time. Then one other story, this is a true story I want to share with you. Just encountered this recently, and it really illustrates so well, I think, coping with stress. A good friend who had lost his spouse a number of years ago and had a child. I think the mother was deceased in childbirth, so he raised this child. And the child was already about to finish high school. That's how long ago it was. And he got involved in a grief recovery program, trying to help other people who had lost spouses. And the next thing he knew, his blood pressure was having trouble to control, and he was having trouble sleeping. And what had happened was, in trying to help others with their grief, his grief was refreshed, and he started experiencing it again. And a number of people became aware of this, and we advised him, that's not where you should be trying to help. Help people with something else. Don't, and this was brought out a little bit in one of the points that was made, is that we all have different gifts. And so if do things that you are competent and feel, and you can master. I'm not saying that we shouldn't try something new and learn a new trade or master a new instrument or something, but we're talking about stress. If stress is being caused by, I've known people, and this may seem radical to you, but they've had years of difficulty with insomnia, with stress, with anger, couldn't manage their weight, because it's true that sweets do produce a dopamine response in the brain. There's no denying that for most of us, if not all, sweets will help relieve the immediate displeasure of stress. But of course, the long-term effect is not good. It makes a different kind of stress. At any rate, it's important to not stay at it. And I was going to say I've advised some people to change your job. Find another job. And it's funny, people oftentimes will look at you and like, do what? Well, I realize it can not always be easy to find a job, but I have to say in my life, I've never not been able to find another job, sometimes not immediately. So you keep your job you've got and keep looking. But if you have a job that is just not fitting you, consider getting a different one. Take some steps that can really make a big difference. So I've got time for one or two questions. Let me share that tomorrow night, I'm going to show the video and talk about forgiveness. And I want to say something about that. I'm glad I reminded myself. I want to say that there are many people who are walking around in stress that what it really comes down to is they have not forgiven themselves or someone else. And so we're going to talk about that tomorrow night. It's really remarkable, and the science behind it is impeccable. But I'll take a question or two if we have time tonight. I don't know if we have, you've got a microphone, great. And it doesn't have to be about stress. It could be about something we talked about previously. See, Barbara has a question.
Yeah, one of the things is, we've been told to relax. And what I found in doing relaxation training with people is thinking about that is if we knew how to relax, we would relax. But there's not direct ways that we're told to relax, even with a lot of the meditation or the mindfulness things, just relax, right? Well, my whole question is, so how am I supposed to relax
Yeah.
my muscles?
Yeah,
Let's
no,
start with them.
that's a great question. And it is too often that we're told sort of like it was obvious, well, just relax. Well, yeah, like you say, if I knew how to just relax, I would. Well, there's three things that this brings up I want to mention. So the first one is really not as directly an answer, but it is true that a walk, not a run, but a walk is extremely relaxing. Okay, so if you take somewhere between say a 15 and 30-minute long walk, it is generally quite relaxing. And in fact, oftentimes people who are having trouble getting to sleep or having insomnia, if they will take a walk 15, 30 minutes, say a half hour before bedtime or so, it can be very effective. Anyway, so exercise, moderate exercise. Okay, then this thing about the relaxation response. I've taught patients, some of them a little bit reluctant at first, but especially, the macho men, they're not, you're not going to teach me to relax. I'm like, yes, I am. So practice. So I want you to close your eyes and relax, and sitting is the best place to be, and you close your eyes. Why? Because you want to focus on what I'm going to tell you, not on what you see happening on the screen. And so you do it right now. So you close your eyes, and then what you do is you take a breath in, a lot of breath in, and then let it out and just slouch, just relax. And oftentimes we find out that we're stressed. We're holding our shoulders up. We're holding ourselves in a tense posture. Just relax. And do it again. And lean back a little enough that you're able to relax against the back of the chair or the wall or whatever you're sitting. And do it again. Take a deep breath in and hold it just a bit, and then out slowly. And as you do this, you can start concentrating on thinking about your shoulders and just relaxing them, and your neck. And then you think about, this is the way I have found works. There's others, I know of other sequences. And then I do my upper arms. So I'm thinking about, I want to relax my biceps and triceps all the way down to my elbow. And each time I'm taking a breath and letting it out, each time I exhale, I'm thinking another part of my body, I'm going to just consciously try to relax, let it slump, if you will, and so forth. Anyway, and do our whole body that way. Do our chest, do our abdomen, do our legs, all the way down to my feet. I've done this sometimes when I was in bed, and a lot of thoughts was running through my head, and I thought, I need to quit thinking about all that stuff and go to sleep. And I'll lay there and do that same thing I just described to you, just going from head to foot. Fortunately, I don't have a lot of trouble going to sleep, so I don't. But I frequently I will not even get to. I don't remember ever getting to my toes. So apparently, I went to sleep before I got that far. And then I said there were three things. Yeah. So another thing is about relaxing. Is I believe that we know the science has shown there is a physiologic response to the exercise I mentioned and the effect it has on relaxation. There's a physiologic response in slow, controlled breathing. I don't know if it's because the body interprets our breathing as an indicator or whether we're stressed. I don't know that we know how. We just know that it works. If you take slow, deliberate breathing, it will cause your heart rate to slow. It'll cause your stress to drop. And if you do it long enough that you can relax each muscle group, you can be quite relaxed in a short period of time. Okay? The other thing is, I remember, turn your phone off, put it somewhere else. So I've gotten in the habit, I don't know why it took me so long, I've gotten in the habit, and my wife can attest to this, that I put my phone on airplane mode or otherwise, and even silence it when I go to bed. And I'm getting more and more comfortable with it even being out of the room. That's supposed to be a joke, but it is true. I can remember, of course, when I was on active duty as a physician, I had to be within reach, so I couldn't really do that. But I'm not in that role now, so I can totally unplug. So anyway, hopefully those thoughts are helpful. There are methods that are physiologic ways to induce the relaxation response. Is there any other question or, well, we've still got a couple minutes before we need to break for our food samples. By the way, I just want to say again, thank you to the people, men and women who've been making food samples for us. They've been very much appreciated. Any other questions? Anybody want to share a personal experience about stress relieving strategies? Okay, well, that's good. All right, well, Paula, why don't you tell us about the food samples, taste samples.
So tonight, we are going to have, Carmen actually did our food samples tonight, and we've got some nice fruit cut up, but she's made a special fruit dip. And I haven't tried it yet. Normally I get to try things, but I didn't get to try it tonight before, but it sounds delicious. So I'm hoping that she'll serve those in the kitchen. So go on back to try some fruit and a nice healthy dip.
Great.
Okay?
Okay, shall we have a blessing?
Yep.
Our Father, we're thankful for food, as I said earlier, and each person been a part of making it. We pray now your blessing on these samples. We ask in Christ's name, amen.
Amen.
Thank you.
Thank you.